A 4-year-old boy is brought to the emergency department for knee pain and swelling after a minor fall while running one day ago. He has a history of easy bruising and recurrent skin and respiratory infections. Temperature is 38.3 degrees Celsius. Physical examination: his right knee is warm and tender on palpation. He has very fair skin, white skin, and light-colored irises. Which of the following mechanisms best characterizes this patient's most likely diagnosis? So go ahead and pause the video and try the question yourself before we go to the solution. Before we go into the vignette, let's understand what Chiedek-Higashi syndrome is. Chiedek-Higashi syndrome is an autosomal recessive mutation in the microtubule. Remember that the microtubule is part of the cytoskeleton and is important in several cellular processes such as mitosis, meiosis, and cell structural support of the cell. And this microtubule dysfunction is caused by a defect in the LYST gene, LYST, also known as the lysosomal trafficking regulator gene. These patients will experience neurodegeneration, histiocytosis, albinism, infections, and neuropathy. Lymphohistiocytosis is the presence of elevated lymphocytes and histiocytes. And additionally, these large granules will be present in granulocytes and platelets. The reason why these patients experience recurrent infections is because microtubules are important in the fusion between the phagosome and the lysosome to allow bacteria to be destroyed by reactive oxidative species produced in cells like neutrophils. Patients with Chiedek-Higashi syndrome will also experience pancytopenia, which is a depression or a reduced amount of white blood cells, red blood cells, and platelets, and this presents with hypocoagulability. Now that we understand what Chiedek-Higashi syndrome is, let's go on to the question stem again. So this patient has albinism, as well as recurrent infections, a fever, a history of easy bruising, and his right knee is warm and tender after a fall. So this patient has a picture which is very consistent with Chiedek-Higashi syndrome, which is an autosomal recessive mutation in the LYST gene. So question choice B is correct. Question choice A, autoimmune destruction of melanocytes, is incorrect because that is consistent with someone who has vitiligo, which is a cause of hypopigmented skin. However, these people, although they may present with similar symptoms to albinism, the skin is typically patchy, and someone with vitiligo would not have recurrent skin and respiratory infections. Additionally, the autoimmune destruction of the melanocytes in vitiligo, the reason why it causes albinism is because melanocytes have melanin in them, and melanin is what creates the pigment of our skin. So if you don't have melanocytes with melanin, then you're going to have that hypopigmentation that you see in types of albinism. C is incorrect because a mutation of the X chromosome would be seen in Fragile X syndrome, and this patient does not have the characteristic features of Fragile X syndrome, such as an elongated jaw, testicular hypertrophy, and mitral valve prolapse. A phenylalanine hydroxylase deficiency would present with musty odor and neurological defects such as seizures, and would not explain the albinism that we see from the question stem. A tyrosinase deficiency is also a defect in the metabolism of phenylalanine. However, this presentation would not explain the recurrent sinopulmonary infections, as this is consistent with albinism.